Ganapathi.
It's 7:45. Let's bring you a story about the team at Ysbyty Gwynedd in Bangor who've been praised by a patient who had a life-changing hip replacement that allowed him to go home on the same day. It's hoped the procedure, available for carefully selected patients, will help reduce waiting lists for orthopaedic treatments and let patients recover in the comfort of their own homes. Kevin Jones is the patient with the new hip, and the consultant orthopaedic surgeon who operated on him is Muthu Ganapathi. They both join us. Good morning to you both. And Mr. Jones, when they told you you're going to have a new hip and you're going to go home in the same day, were you worried that they'd be packing you off home in a fair bit of pain?
Not really. Everything was explained to me that, if there were any complications, that I would not be going home that day. It was a bit surprising to be offered it in the first place, but yeah, it's worked well.
I assume they don't just send you home with a leaflet. You get some, pain relief or at least good advice on how to manage things when you get home.
The whole team is there, the nurses on the ward, the physios, Mr. Ganapathi, everything's explained to you. You're given precautions, you're given your pain medications, you're assessed for mobility before you go. So there's lots of boxes to be ticked before you can be discharged safely.
And how is the recovery from the operation going?
It is going really, really well. I think the fact that you're up and moving straight away it helps with the recovery. I went to see Mr. Ganapathi and the team the week after, and I was able to walk with unaided, with no sticks. It was really good. It's progressing well.
And we're told that it's not available for everyone, this operation. So how did how were you chosen?
I think, given my medical history, that I'm reasonably fit. I'm 55, so I'm not. I'm quite young, and my lifestyle has been quite good. I think I met that criteria. I think the expectation from other people should be measured. Really, there might be complications that will mean they can't actually have it on the day and discharged.
When was your op?
It'll be 8 weeks this Wednesday.
Right. So are you back up and about? You're a nurse. Are you back at work?
I actually retired and have returned to work. And
okay.
I'm due to go back a week, the end of this week, actually.
Okay. And
so I'm walking well. I'm going to the swimming pool, doing some work there, trying to get some strength back. It's good.
Okay, well, congratulations, Kevin. Let's talk to his surgeon, Muthu Ganapathi, and there are awfully long waiting times throughout the NHS in Wales for operations like this. Will this help, the ability to operate on someone and send them home so quickly? Is that going to help with waiting times?
Good morning, Daniel. Thank you very much. Yes, in the sense that because we are using the resource of the bed, which is the biggest premium at present in the NHS hospitals, so that we don't have a shortage of beds. And that is a big difference, because if we don't have the bed, we cannot operate another patient. So by doing these sort of day surgery procedures, we can do more patients with the available resources.
Yeah. I mean, here in our newsroom, we hear no end of stories. I know a couple of people in my own family waiting years and years for operations. What's the situation like with you? Is it the lack of beds that is the problem, or a lack of staff?
I think, obviously, the COVID changed everything, isn't it? There's a big backlog.
Sure. And
with the elective joint replacement, we need to have a ring-fenced ward, clean ward. But that obviously was affected quite a lot with the COVID ward closures and all those things. So there's significant backlog. But we did, 2 months, 3 months we did. But now we have been operating uninterruptedly since April this year, which is a big thing. And we commenced it. In fact, I started the first day surgery hip replacement in February 2020, just before COVID.
Right.
Then COVID hit. But in a way, it helped to some extent, because patient did not want to stay in the hospital. That also helped to do more patients as well. But if you go to US, for example, 70% of the joint replacement in some centers are done like a day surgery procedure. You can imagine how much bed we can save by doing that. In UK, it is still a small proportion, but is gradually catching up. But it's a big team effort, you see. We are not cutting corners. So I always tell it's like a Formula One pit stop. If you look at the Formula One, it's about 50 years ago, the pit stop was 60 minutes, 60 seconds or something. Now it's so short, but they're not cutting corners. Everybody's working together. So basically a 3 or 4 day work is done within the day.
Right, but it takes a lot. It takes a lot of people, a big crew to do a pit stop. Presumably, a lot of professionals, highly trained people to do these operations so quickly.
Exactly.
Have you got those staff coming through? Are the people being trained?
They are the same staff. Basically, instead of getting up the next day, they start getting up the patient within 4 hours. So everything's sort of done quickly. But the whole expectation, preoperative counseling, everything is done beforehand, and the patient sees the physiotherapy beforehand. And so everything is compressed together. You're right in the sense, do we have enough therapy support? We could do more, but we need to have longer session with the therapy staff and things like that. That's been shown in studies as well. But it's a start. But we have started doing more and more of these procedures. And I think once it establishes, it makes a big difference.
OK, that's orthopaedic surgeon Muthu Ganapathi. Thanks so much. And Kevin Jones as well, a story that may offer a glimmer of hope to very many people waiting for joint replacements.
Love that analogy about the pit stop. Very nicely done. Right then, are you